Okay, the conversation continues, and I have the very dubious distinction of being joined by two extreme talented leaders in our community, Dr. Annette David. Doctor, half a day.
Good morning.
Good morning, and a wonderful relay to you. And of course, let's see, former Chief Justice of our Supreme Court, former Speaker of the Legislature, and now Guam's Public Auditor, the Honorable BJ Cruz. Half a day.
Good morning, half a day.
And thank both of you for joining me, because we are talking now about the topic of control of cancer in our community. And I would always like to think that always goes back to leadership. And, you know, for people that would like to take a strong role in being able to make sure that the community understands the nature of cancer and how we can move forward and manage that and be able to issue, you know, marshal the message and communicate. Dr. David, you can probably speak to this way better than I can. So your thoughts.
Leadership is just so fundamental for cancer control. Cancer for me is very personal, you know. I come from a cancer family. And as a physician, I thought at one point I was going to pursue special training in hematology oncology, because I had patients who had cancer and they really affected me a lot. But then, you know, I quickly realized that the clinical care is important, but it's a little bit too late. When you get patients with cancer, you can only do so much at that point. And so it really dawned on me gradually that the key was to intervene upstream before cancer happened. And so cancer prevention became very, very important to me, because so many members of my family have died or have fought cancer. And I decided that what I should focus on was really trying to create change to prevent cancer through policy. But that requires working with community, and it really requires working with community leaders and political leaders. And so for a long time while he was in the Senate, Speaker BJ was our champion. And that was very, very important and impactful to the changes that we made in the policy landscape, which I think have contributed to reducing cancer incidence and prevalence here in Guam.
And I think it's also interesting with your role as a physician, you not only have to you know, understand the nature of the disease, but you also have to have a strong sense of empathy and
That's
understanding
right.
of the patient themselves. And that can be a very difficult thing to do.
It really is. And I remember as an intern, when I lost one of my cancer patients, it was devastating to me. And I think that kind of started this insight that, you know, we can give so much to the care of patients with cancer, but if we catch them at that late stage, there's not really much that we can do. And the big changes can happen upstream with policy change.
Okay, and BG, I would say the same for you, because you are someone who's been no stranger throughout your distinguished career as far as making tough decisions, but also in understanding people and, you know, and when working with the actual individual who is affected by what can be very difficult things.
Yes, and though later in my life, cancer has become a reality in my family and personally, I've been involved with the American Cancer Society since about the time that you were born. I was a member of the American. Yeah, I was a member of the American Cancer Society board in the late 70s, and chaired the American Cancer Society in the early 80s. And it was during that period that after a couple of years working with a really great nurse, and her name was, now I'm going to forget, Jean Kerr. She was the nurse and a member of the board at the time. And she and I used to, whenever she would get notification that somebody on Guam passed from cancer, we had a map of Guam on the wall, and we would put push pins in the map, and we would show where the clusters were and how it was spread throughout the island. And so when I became chairman in the early 80s, one of the first things that I wanted to do was do what Dr. David was talking about, and that was education and prevention. And so that's when we joined and got certification from Hawaii to come on board. And then they provided education, because like everything, I mean, even this whole Black Lives Matter and racism and everything, a lot of it has to do with early prevention. You have to do the preventative work early, have, you know, early childcare, early schooling for children, and sharing everything. But as far as cancer is concerned, leadership was trying to get the education out here, and so that was a big move in the 80s. And I thank Jean Kerr for her educating me about the need to do that, and helping me move the American Cancer Society Guam unit in that direction. And then in the last 15 years, Dr. David and I have joined up forces and worked together on various projects to further the cause of prevention of cancer, with her educating me on the need to get certain pieces of legislation through to be able to fight this dread disease.
Now, I was going to say, can we talk about that? Because obviously in the life cycle of leadership, you've got an awareness and understanding of the problem as it is, and then you have, the communication and, getting others in your way of thinking on board. And now you actually start to put together an action plan. So, Doctor, how would you say you actually carry that over to like say what BJ was talking about now to public policy?
Well, I think to frame it, we need to see cancer not just as a disease, but as an issue of social equity. It really has a lot to do with social and commercial determinants of health. And so, there is a life cycle of advocacy and education, but ultimately it's got to be education with a very concrete action in mind. So, in leadership, they say begin with the end in mind. And what we really sought to do with Senator BJ, with Kathy Castro, with the other members of the NCD consortium, with the American Cancer Society, was to create a change in our policy environment so that we could create a physical and social environment that was promoting health rather than disease. So a lot of the targets were the risk factors for cancer, predominantly tobacco and alcohol, but also looking at nutrition and physical inactivity. And I think that's the key, is that it is a process. You have to be very clear about your vision, and you have to be strategic about how you achieve the vision, because, right, Speaker BJ, it wasn't easy. I mean, every step of the way you have hurdles and obstacles that you have to overcome. And so the partnerships are important, and the strategy is very critical.
Now, how, I guess my final question would be, as we wrap up, there's going to be a lot of young people who are watching us right now and saying, this is wonderful. I'm very inspired and I'm very uplifted by what they're saying. However, I'm just a kid, but cancer has touched my family, my classmates, people I go to church with, and I don't use the word, hate very often, but I hate cancer. I don't like what it's doing to our community. I've got the passion. I want to lead, but unlike Dr. David, I did not go to medical school. Unlike, BJ Cruz, I did not go to law school. What can I do in my capacity so that I can lead my peers and hopefully bring about change?
Well, as far from my point, it's what Dr. David was talking about, is the non-communicable diseases, to recognize cancer as a non-communicable disease. It's not something that can spread like coronavirus. It's something that within your life cycle, within yourself, have to address. And you can control certain things. And the young people at this time can just remember, please, no smoking. For as much as we talked about washing hands now, no smoking should be the same thing. Absolutely no smoking, because the addiction is virtually impossible to overcome, and to exercise, and just try to stay healthy, to lead a healthy life, and to learn from the doctors and the advocates at non-communicable disease, NCD, of the foods to eat and the foods to avoid. But it is an educational process. But as young people, just stay away from tobacco.
I think also it's important to emphasize that leaders occur at all levels, and that you can be a leader even as a young person because you're an influencer. You have your own circle of influence, and that's where you can really carry the message. The other point is also to emphasize that even during a pandemic, cancer goes on. It doesn't stop. And I will share with you very quickly, I myself just went through cancer surgery 3 weeks ago for skin cancer. So cancer doesn't stop. And so having leaders at every level, especially young people, they are the ones who can really create that change and amplify the change. And so I think it's important to remember that we are all leaders and we all have our circle of influence where we can get the message out that cancer can be prevented and we can do many things to reduce our risk for cancer.
Well, thank you, doctor. And I know I speak for everybody by wishing you good health, and we also wish you a swift recovery. And of course, the mark of a good leader is that, you know, you don't take everything on yourself and you rely on the strength of your peer group, of your community. And that really comes down to Inefamalik and what we do as Guamanians. And we, you know, we really draw upon the strength of our community. So former speaker BJ Cruz and Dr. Annette David, thank you so much for your wisdom and your time and your leadership. Thank you very much.
Thank you.
Thank you.